Let's listen to an expert doctor for hypertension in young population along with coronary artery disease and higher heart rate. Can be sure of happy heart? Today we have Dr. Shrimanth Cardio, Jaydeva Hospital, Mysore. Doctor, can high blood pressure be completely cured?
We need to understand what hypertension is. Hypertension is state where the blood is being pumped through the arteries at a very increased pressure. So that is what hypertension is. It's a new level of pressures at which the blood is being pumped. So it cannot be completely cured, but it can be managed with lifestyle modification and medications when required.
Doctor, what is the relevance of heart rate in hypertension?
Heart rate and hypertension both go hand in hand, and increase in the resting heart rate is associated with an increased risk of hypertension incidence, and an elevated heart rate in hypertension further elevates the risk of other adverse outcomes related to hypertension. So there are studies have shown that heart rate is an independent risk factor for cardiovascular and mortality related outcomes in patients with hypertension. So there are multiple medicines like beta blockers which are used to treat hypertension, which also have a significant they bring about their action by having a good effect on the heart rate. They decrease the heart rate, and that's how they also regulate the blood pressure control.
Doctor, what precautions should a patient take along with medications?
Hypertension is a lifestyle disease. So once a patient is diagnosed with hypertension, the first thing to do is a good lifestyle change. That includes diet, exercise, adequate rest, and stress management. So diet, they should follow the low sugar, low salt diet, and they should increase the elements which like vegetables, fruits rich in potassium. So all these things have to be increased. And coming to exercise, it has to be no matter how short it is. So they should be regular. So whatever their lifestyle permits, there has to be some time allocated for exercise, and that should be regular. And stress management, like in the form of yoga, or exercise, or meditation, whatever makes them feel good or happy, they should see to that their stress levels are kept low. And then comes the most neglected part, a proper schedule of sleep, that a bedtime and wake up time should be consistently more or less maintained regular. So that keeps their adequate rest is very essential to have a good BP control.
Thank you, doctor, for your time.